have a quorum, and review of the minutes. I think you've all received those, I think, beforehand. Are there any addition or corrections? Is there a motion to approve?
So moved.
Second?
Second.
All in favor?
Aye.
Opposed? On the health officer report, I think I'll report that we met in executive session to discuss nominee for the position of health officer. And we discussed the issue of the candidates and came up with a consensus. And the consensus on that meeting was that we appoint Dr. Jennifer Jones Bales to be the health officer, and I should say we recommend the appointment to the commissioners. I'd entertain a motion to that.
So moved.
Second.
All in favor?
Aye.
Opposed? Okay. So, any of the commissioners who are here have questions or such, I'd be glad to meet with you after the meeting. Okay. Let's move on to the directors.
I will try to make this quick since we've had a lot of meetings recently. So the first is Health First Indiana. The only update I have on that at this particular moment is we've scheduled a meeting with the State Department of Health and all of our community partners. We're going to do a virtual meeting and we all come together and for reporting and invoicing and all that good stuff to make sure we're in line with the State Department of Health's guidelines. And that is scheduled for the 20th, this Friday. Financial report, we're continuing to work on budgets. We do have a meeting scheduled for, it's not 9/20, with SoftWorks, I think it's next week. October 2nd. With SoftWorks to come in and get us set up, and SoftWorks is that financial software that was approved for the health department. Going to staffing updates, we filled the part-time FEMA position, essentially waiting on a background check to come back. Should be starting next week. We've posted the clinic deputy director's position and 3 medical assistant jobs on the portal. We've had 3 applicants for the clinic position and 4 applicants for the medical assisting position. We scheduled for the 4 applicants for interview next Monday for the medical assistants. Would anyone on the board want to join in on the interviews for the deputy clinical director? I can just send out a general invite to everyone, and if you want to show, then you're more than welcome to show. Let's see. We're working with our county's attorney on the Virgin's contract, and I'll pass it over to Chris, and he can kind of tell you where we're at with that contract. Virgin's is the company that we're going to use for staffing.
So I've been in discussion with Virgin's attorney, a gentleman by the name of Jim Brown. We've gone back and forth several times. The original agreement that they sent to us was a very bare bones agreement. It didn't have a lot of the state required clauses and that sort of thing. So I'd say we're about 90% of the way there on the agreement. We just discovered one issue that we need to change. A couple other issues that we're working through regarding liability. But the insurance that they provide seems to be adequate, and I don't see any real issues moving forward on that.
And once that contract is in place and approved by both the commissioners and the health board, at that point we can move forward with a PA or nurse practitioner.
It's fairly important. And it could cause us to move up our next meeting.
I wasn't going to say it. I'm glad you did.
Because basically, that's how we'll get either an NP or a PA.
Okay.
And they're vital. And so we may be meeting a couple weeks or.
To touch on his point, that was further down in my discussion, but to touch on his point, we've essentially had to pause services at the health department because we have no one to write prescriptions. So you'll see later on in your packet, towards the end there's a fee ordinance, and you kind of see what we charge for the different things that we offer there. We've had to put a lot of those on hold. So we can't do testing and we can't do treatment. We can still give shots, immunize, and things like that, but we can't test or treat for HIV or hepatitis or any of the STDs until we get someone in place.
I will add, though, that if Dr. Bales is appointed, and once that's in place, she can sign. We can work out a mechanism. We discussed that with her, in fact, to work out a mechanism where she could sign those prescriptions so the department could move on. And we're hoping that that would be just a temporary measure until we get PA in place. But once she's in place, we will have a mechanism.
And once she's in place and the PA or MP, Medicenter is who we have a contract with when it comes to the 340B program. So I've reached out to their head pharmacist, and once we have both of those positions in place, then we'll all meet so we're on the same page as far as getting the scripts to the pharmacy and reimbursement and all that good stuff. A lot of moving parts. We moved a contractual nurse into a full-time, not a full-time, but a part-time county position that was already budgeted this year. We're going to get into program updates. I sent the board a couple operating procedures. If everyone's had time to review them, the first one is what we discussed in the last meetings when it comes to the rabies vaccination series. So I'm proposing that in this procedure that they respond to Reed Hospital for the first dose and then follow up with us at the health department for each remaining dose after that. And that was due to the cost of the vaccine, the shelf life of the first dose, so forth, so on. Are there any questions on this procedure?
If there are no questions, I'd entertain a motion. Move for approval. Is there a second?
Second.
All in favor?
Aye.
Opposed?
The second standing operating procedure is something new. We've not had any discussion on this, but the subject keeps arising for us at the health department when it comes to well water testing. There's no private entities out there that test private wells, and that needs to be done for real estate transactions, health issues, things like that. So we've reached out to home inspectors and well drillers and things like that. Nobody will do just a simple water test. So I'm proposing that I've drafted the SOP for it, that we test the private well water for a $25 administrative fee. So as of right now, we use HML as a third-party lab. It costs the consumer, the citizens, $35 plus a $10 courier fee, and they have to test it on their own. This is for a lot of FHA loans. They can't do that. They have to have a third-party test it. So those people have to scramble or pay triple the amount to get someone in to do it. So what I'm proposing is we charge them a $25 administration fee, the $35 lab fee, and we take those samples, we test 1 day a week, collect all the samples, and we take them straight to the lab in Muncie. And that saves each person $10 for courier fees. So it essentially costs them $60 for a test.
And I think this would be a good service for the town to have this available.
So with that said, to add that charge to that service, the fee ordinance itself would have to be amended. So I put that in for your review. I put it in there for you guys too, Ron. And I've highlighted essentially what we would change in that fee ordinance. So on the second page of that ordinance is definitions. So I've added a definition of private drinking well and a holding tank. The holding tank was approved months ago, but for some reason I forgot to put the definition in here. And then on page 4 of that ordinance, you'll see at the bottom there where I've added private well water testing administrative fee. This is not going to be a huge moneymaker at all. The upcharge on it is not much at all by the time you get staffing and stuff in there, but I think we have the funds and the ability to do it. And it could eventually expand maybe from that point.
Other questions? I take this and I think there should be two different motions. One is procedure, which basically is board approved. The other has to do with an ordinance, which then we would recommend that the commissioners approve.
Are we ready for a motion?
Ready for-
Oh, I thought you were I'll recommend the ordinance to the commissioners.
Second.
This is for the ordinance for the commissioners. Okay.
Yep.
All in favor?
Aye. And I'll recommend procedure.
Procedure.
I'll second.
All in favor?
Aye.
Opposed?
Dr. Ryder, when you're going to try to get on the commissioner's agenda? You're going to try to squeeze it in tomorrow?
Yes.
Okay.
Oh.
So, since he's already there, I'll try to squeeze myself in as well for the fee ordinance. I'll get with Bobby after this meeting. And for the, let's see, we do have flu and COVID vaccines now available for all ages and programs. We conducted final TB testing on the small outbreak on the western side of the county. This week, we're operating vaccine clinics at Fairview Elementary School, Vale Elementary School, and Earlham. And then we have 2 more schools scheduled for next week. And the last thing on my agenda to speak about is the SSP. The SSP, which is the syringe exchange program, has kind of went off the rails in the last couple years. So I'm trying to bring it back down to its intended purpose. I had a meeting yesterday with State Department of Health staff that run and operate that program. So right now the biggest issues is the numbers and how we're receiving the syringes back. If you look, the 2 documents I provided, the first one is August of 2022. We had 115 participants that month and handed out 7,691 syringes. This is soon after inception, I think a year. I think we started in 21. If we move on to August of 24, we had 62 total visits, but we handed out 18,875 syringes. Those numbers is completely not close to being right. I mean, I don't have words to explain these numbers. So the question I posed to the State Department of Health yesterday is I've read statute, and statute has nothing to do with this. I've read their guidelines, and their guidelines, it's may, not a shall. And then after having that meeting yesterday, they confirmed that as well. So I'm recommending that we set a total number on the amount of syringes that we
Can be distributed during one visit.
one visit.
Yeah.
They can bring back as many as they want. We'll take anything they want to bring us off the street, but so in all fairness, there's different scenarios out there. You know, the user may also be a diabetic. You know, the state told me to keep this into consideration. So I think a more than fair number is 100 per week. That is over 10 syringes per day. So if the board's agreeable to that. And we're also going to require, we're getting syringes back in Walmart bags, cardboard boxes, you know, things of that nature. So, and we hand out each participant a sharps container on the day of. So they either lose them or, you know, whatever. You get all kinds of different excuses, but we're going to require that they come back in the sharps container. And if for some reason they don't have a sharps container, then a laundry detergent bottle,
Don't be
coffee
super hard
can,
plastic.
something to where, you know, we prevent exposure essentially. So with the board's approval, I would like to move to that process.
And this state programming kind of supports this?
They absolutely support it.
Okay,
Yeah,
okay.
they seen the numbers, and after the conversation yesterday, they were very supportive of it.
So previously, there really hadn't been a limit on the amount of syringes that could be distributed at any?
No, there was never a number. It was up to the local jurisdiction on how they operated their program. There's a few things by statute. You know, it has to be anonymous. You have to offer treatment. You have, you know, do referrals, things of that. But other than that, it's pretty wide open. Like I said, it's a may instead of a shall when it comes to the guidance document.
Yeah.
And the one state employee even offered to come down and help bring a little order to it. And some of this could be cleared up too once we have more staff hired and trained. But I think 100 syringes is more than fair for a 7-day period. They have 2 opportunities a week to come in and exchange if they want. They can do that. You know, the theory of 1-to-1 is not. That was kind of made up. It was never that was never the state's intention. You know, you give one, you get one. That was never the intention. We had a female about 3 weeks ago bring in 4,500 on her own. So we didn't have that many on hand. So that's when it first crossed my radar, essentially.
Yeah,
So,
yeah.
Do we anticipate that with such a transition in protocol that there may be more infectious disease spread, or is...
I don't believe so. What I'm hoping this does is if we limit the number, I'm hoping it will bring more people in. Now they have less, so now I need to go there and get
Right.
more.
It won't be one representative.
Correct.
You actually will maybe
Yeah.
get more participants that way.
Now we can get referrals, we can get testing on more people. It's my prediction. You can't predict it, I have no idea,
Right.
but that's my intended purpose.
Yeah, I think the other, somebody really found how to abuse that, because my guess is they were selling it. They didn't get that many. And
Yeah,
that was
that's
never our
not the
intent.
intent.
It was to
Yeah.
get the needles and the syringes out of the parks and back here and reduce the hepatitis C.
Right. And it, you know, limiting then increases the opportunity for intervention and engagement. I think the staff need to be prepared for the potential backlash from the participants. So that'll be something.
They
to
are,
kind
and
of-
we're gonna
Yeah.
soft play it. You know, it's just not gonna be one hard cutoff. It's gonna be a couple weeks of, hey, this is coming, be prepared, you know, type thing. So. And typically when we make any modifications, change of schedule, or anything, it's weeks in advance, and we give each participant a document so they have something hard copy to them.
In the end, you can just blame us.
What's that?
I said, in the end, you can just blame us.
Yeah, absolutely. That's what we have a board for, right?
I will
We're a
also.
strong board.
I would suggest to say the state in case it's just a guideline.
I will also share that I supply a Narcan box at our 15th Street location where the syringe support program is located, and it is emptied every single time we have an event with this. Yeah, I mean, it is really utilized. So I just, want to say that there is a lot of harm reduction supplies being offered and used, so.
And am I correct that this area of the state, this east central Indiana area, has very high administration of Narcan compared to the rest of the state?
I'm not aware of
We've
those
really
numbers.
made an
Yeah.
effort with Overdose Lifeline to distribute and have it available for free in our communities. I know that. So we've really tried to saturate the state with it, so.
We have 10 locations just in
Wayne
Richmond.
County.
Yeah, in
Or
Wayne
Richmond,
County,
yeah.
These are all located in Richmond, but
Mhm.
where people can get it
Yeah.
without going in their boxes.
Yeah.
Dan, when's the sunset?
When's the sunset? I don't know. 1915 night.
What's that?
What is our current longevity for the program without having to be reauthorized?
When does
Oh.
when does the program end?
It's I'm picking up what you're putting down now, Ron. It's June of next year.
Gene, that's what
At 1,900 hours, right?
Sunset.
It was dark a little bit after 8 yesterday, I'm not sure.
I'd entertain a motion for change on syringe policy.
So moved.
I'll second.
All in favor?
Aye.
Opposed?
That's all I have. I appreciate you showing up.
The next meeting will be October 15th, but I think it's really going to be timed by when the Virgin's contract is available.
Dr. Ryder, I may not have heard you. Does she have to supply her med mal, or do we
We have to,
do that? So,
liability.
yeah.
She would have some med-mal while she's at Reed, but I don't know that it would cover her outside Reed.
Well, so we can get that, I think, bound pretty quickly. Is that our assumption? Once she accepts and is under contract.
And I think it's what we did for Dave. It's whatever we did, it'd be the same that we did for Dave.
I think when I had that discussion with a former employee, they told me it could essentially be a 2-3 day turnaround from the time they apply for it to the time they can get it, if that's what you're asking.
Other questions? Entertain a motion for adjournment.
So moved.
Second?
Second.
All in favor? Opposed? We're adjourned. Thank you, everyone.